GOP members of Congress went back to their districts frustrated over the weekend after failing to take the first steps towards dismantling Obamacare.
This is a disappointing day for us. Doing big things is hard. All of us, myself included, we will need time to reflect on how we got to this moment, what we could have done to do it better.
In a crushing defeat for House leadership, Speaker Ryan was forced to cancel the highly anticipated vote on the American Health Care Act after not getting enough support to pass the bill from his Republican colleagues. But there were signs of trouble even before the bill was released, with Senator Rand Paul and members of the conservative House Freedom Caucus, like Congressman Louis Gohmert, voicing disappointment the plan was crafted behind closed doors and not in a more inclusive discussion with a variety of GOP lawmakers.
We have got to do something, but now instead of having listening sections and then going behind closed doors and then saying, here's the bill, you got to vote for it, we're not going to change anything, take it or leave it, but you can't leave it, everybody's got to vote for it. This time I'd like to see us get together with it. There's some great people in our Republican caucus, terrific, brilliant. We can come to an agreement.
Freedom Caucus members wanted to see a clean repeal of Obamacare and were concerned the new plan did not do enough to drive down the cost of premiums for the American people. Gohmert told CBN News he thought the bill left too much power over the healthcare system with Washington.
I don't think the cure for the disaster of Obamacare is more federal control, more power in the bureaucracy.
Gohmert says he's ready to get to work with the GOP conference to craft a new health care plan.
We're going to start on that next week because health care is so personal. It's people's lives, and we got to help.
President Trump took to Twitter over the weekend, blaming the conservative group for saving Obamacare, saying, Democrats are smiling in D.C. that the Freedom Caucus, with the help of Club for Growth and Heritage, have saved Planned Parenthood and O-Care. Democrats like Nancy Pelosi are ecstatic that for now Obamacare remains the law of the land. But Freedom Caucus Chair Mark Meadows says this is just the negotiation process, and they are still committed to helping President Trump deliver on his promise of repealing and replacing Obamacare.
I can tell you that conversations over the last 48 hours are really about how we come together in the Republican conference and try to get this over the finish line.
Meadows also disagreed with those questioning Speaker Ryan's leadership abilities.
I can tell you there is no conversations going on right now with regards to replacing the Speaker. It's all hands on deck with regards to Obamacare, tax reform, the border wall.
And Freedom Caucus member Trent Franks of Arizona told CBN News that despite the setback, the Republicans aren't giving up.
I'm convinced that the president did not fail the country here. Unfortunately, the Congress failed the president. And I hope that somehow we will go back and understand where we went wrong and do better this next time.
Many members of the Freedom Caucus are vocal supporters of President Trump, who says he's learned a lot from the healthcare defeat, but is ready to move on and focus on the future.
We all learned a lot. We learned a lot about loyalty. We learned a lot about the vote-getting process. We learned a lot about some very arcane rules in, obviously, both the Senate and in the House. So it's been, certainly for me, it's been a very interesting experience. But in the end, I think it's going to be an experience that leads to an even better health care plan.
Speaker Ryan says Republicans are going to move forward with the rest of their agenda, securing the border, rebuilding the military, and tax reform. Reporting from Capitol Hill, Abigail Robertson, CBN News.
Thanks, Abigail. With us now is David Brody. David, you know, there's some people who think that what they were doing was just fixing Obamacare around the edges and it's still going to collapse. And when it collapses, at this point, the Democrats own it 100%. So really, they may have been doing Trump a favor. What do you think?
Well, Pat, I think part of the problem here is that a lot of folks were calling it Obamacare light. They really weren't repealing the whole bill. I know there was going to be a phase 2 and a phase 3, but they weren't repealing the whole bill. And so the last time I checked in politics, replacing a bad law with a bad bill makes bad politics. It's really that simple. And here's the problem for the president. Donald Trump wanted the Freedom Caucus to have his back. But the problem is that the constituents in the Freedom Caucus's districts, in other words, those that voted for Trump, realized this was not a good bill. So they didn't have Trump's back. I mean, look, if this was a good bill, they would have called the Freedom Caucus members and said, come on, folks, get with the program and vote for it. But they didn't do that because it wasn't a good bill to begin with. And I think that's the inherent problem here.
Well, David, you know, that deal that's there, the Obamacare, is going to collapse. I mean, the exchanges are collapsing. The health companies are going out of business. And and the premiums are rising dramatically. I mean, this is going to be a disaster within a few months from now.
Well, it's heading that way. The problem for President Trump is that he says he's going to wait for that to happen, and then Democrats will come begging to him to change it. I'm not holding my breath, Pat, that Democrats are going to be coming to President Trump saying, please, we're ready to make a deal now, even if it goes south. I mean, I don't think that's going to happen just politically. It's too partisan in Washington for that to happen. And so, you know, where does that leave us? It leaves us with President Trump trying to figure this thing out. Does he go with moderate Democrats, whether it be on health care or tax reform going forward? Does he try to work again with the Freedom Caucus? He's going to need them as well. He's going to have to choose here because he may have to jettison the Freedom Caucus and go with moderate Democrats to see if he can get something done. The problem is, Pat, no moderate Democrat's probably going to want to work with Trump. And so he's got that problem. And then with the Freedom Caucus, they're willing to work with him, but Trump's got to deliver something better than what they did on health care.
You suppose he's going to pivot and forget health care for a while? I think that's probably what he'd do, and pick up taxes.
Yeah, he's going to pivot away from health care for now. It's the ... for now. And the Freedom Caucus members are going to go ahead and work on some sort of plan that they think will be palatable to Speaker Ryan and to some of the moderates and to the president himself. And then it's on to tax reform as we speak now. But look, tax reform is going to be, I mean, you know, it's interesting because tax reform is really Trump's bread and butter. And why they didn't start with that over health care reform has a lot of folks up here scratching their head. One of the reasons they thought was that if you got to do health care reform and fix some of that tax structure before you can go to the larger tax structure problem. But it just seems to me like Trump was playing an away game all along, to use a baseball term, and really he needed to probably play that home game, which is tax reform. They're going into his wheelhouse now, so this should be different. We'll see.
Have you got any framework of the current tax bill? We've talked to the head of the Ways and Means Committee. His bill is fantastic if they put it through. Is that what they're going to support, do you think?
Yeah, I think it'll be something along those lines. I also think that, remember, we're looking at obviously corporate rates coming way down under Trump. I believe it was at 15% is what he wanted. It might be 20. I'll have to double check that. Between 15 and 20 for sure. But I can tell you this, Pat, this administration understands one of the lessons learned here, which is they've got to push this. The president has to be very articulate in terms of what he wants in a bill. It wasn't that way with health care. He didn't sell it as much as he could have. And so on tax reform, they're going to take the initiative here, and then the president's going to sell it a lot more than he did health care.
David, thank you very much.